The doctor is in. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk. Playing has always been a part of our childhood, but did you know that it could also be used in medical interventions? Brain development is important in a child's overall well-being. One of the ways to develop this is through play. After all, play is more than just a leisure activity. Play therapy helps children with a lack of social or emotional strength to communicate better. It changes their behavior and develops problem-solving skills. Let's get to know the methods used in this kind of therapeutic intervention and how important is the role of parents or guardians in play therapy. To give us more information about this topic, we have on the program Ms. Eileen Sison. She's a play therapist and former president of the Philippine Association for Child and Play Therapy. Welcome to the program.
Thank you. Thank you for having me.
Now, this play therapy, what exactly is it?
Play therapy is an intervention tool wherein the therapist uses play as a form of therapy to address children's behavioral problems, social-emotional issues, and also trauma.
Is play therapy popular here in the Philippines?
It's not as popular in the Philippines, but it's very popular around the world. Though we've been practicing here in the Philippines for more than 30 decades in terms of our mentor, Dr. Carandang, who pioneered play therapy in the Philippines.
So it's been around for around 30 years already?
Yes.
Okay. Now you mentioned the criteria for someone that may benefit from play therapy, but how can parents pinpoint these things in their child?
Usually when there are concerns in terms of adjustment in school, when the children have unusual fears at home, when they have difficulty relating to other children, other people. So those extreme behaviors that we see in children may benefit from this form of intervention.
Now, is there a certain age where play therapy is most effective?
Usually we do play therapy with children as young as 3. I've had children, clients as young as 3, to up to around 12 or 15. No? But we also do play therapy for adults. Because we also feel that, play is something that we all should be experiencing and having in our lives. So it's something that we also incorporate in the therapy if it's needed.
So let's talk about the younger age group first. So what type of interventions can they expect?
When you say play therapy, the setup of the room is that there are toys around because we use the toys as a way to help the child express what he or she is going through. No, because play, for children, that's their way of expressing themselves. For adults, we do talk, but for children, sometimes when they are in very extreme feelings of anxiety or distress or sadness or fear, they have difficulty expressing that, and they express it through the play, through the toys that they use.
So in your experience, what kind of reactions do you get? So some situations here, maybe the child has trouble with, let's say, coping, probably with family members, maybe with the parents, and you could see this through play.
Yes, so they play it out. We have a set of toys there. We have a dollhouse, we have families, small doll toys, and they play out the problem, the scenario in the home. And it helps them to express the emotions that they are going through with that problem at home. At the same time, make sense of it, gain control of the situation, because play is their world.
Okay. Now, how about for the older children? I'll just give an example. It's rampant right now, probably bullying.
Yes.
So you could probably, some parents who might think that their child might be having some troubles with bullying, you give some intervention of play therapy. What kind of intervention can we expect?
It's the same. In the setting of the therapy session, the therapy room, they use the toys to express their feelings of anger, of powerlessness, of frustration over the situation. So it becomes a safe place for them to express how they feel and make sense of all these feelings so that they're able to go into the real world and cope with that bullying situation.
Okay. Now, a lot of kids might watch this and think that part of the session, or they might have justification of playing more video games, especially online. Would you think that playing online, playing video games online could be form of therapy?
Well, that's a very tricky question because it's a reality that these games are here.
Right.
Okay, but I think as parents, we also have to monitor that, no? Because we have a lot of cases wherein there are there's an internet addiction is very rampant right now.
Right.
For younger children, and this is also may cause children to have ADHD, short attention span. So there's a lot of disadvantages. That's why I think parents and guardians have to monitor the use of internet. It's okay to use it, but there has to be a balance in the child's life.
Right. And I think that's a key
Yes.
word there. It's the balance.
Yes. We have also done play therapy in disaster areas.
Okay.
We have gone to places wherein all the disasters we've been to, and usually when we work with the children in disasters, we do play therapy. And the play becomes a way of them to cope with the situation, with the disaster all around, with the tragedy.
In your experience, do you find play therapy effective, especially for children who have a tendency to harm themselves physically?
Yes, I think it's very, very crucial, that it's very important because for one, children that tend to harm themselves have difficulty like thinking of ways to solve a problem. That if I can't get this, if I can't have this, I'll hurt myself. It's like we have to teach children other options in terms of solving a problem. In the play therapy session, we usually help them with that. We empower them to think of decisions, think of ways to solve a problem.
This could be also effective for those children or for those parents who feel that their children cannot really communicate that effectively with them either.
Yes.
The child cannot tell them their own problem.
Yes, yes. So we also really, a part of the intervention is we include the parents, we give them feedback so that they can also consistently do our recommendations in the home.
Very well. Do you have a word for our audience?
It's important that we don't forget that children should be allowed to play. There's so many things going on in our society now, so much pressure. Just in the news, children get affected by what they hear. And for them to be able to cope with all these stresses around them, play is the very key for them, to help them. So don't forget that we all should still play.
Very good, very good. And
Okay.
thank you very much, Ms. Eileen Season, for joining us here in the program and sharing your insights on play therapy.
Okay. Thank you.
And stress could trigger different kinds of medical conditions. So how can we manage stress and avoid serious medical problems? The answer is when we return. Keep it here on Med Talk Health Talk, only on CNN Philippines. Now that classes have already started in some schools in the country, parents or guardians deal with not just the safety of their school kids, but also with everyday stressors. Now, to give us more insight on how parents can deal with these kinds of stressors, we have in the program Dr. Joan May Perez Rifarial. She's a clinical psychiatrist from Veterans Memorial Medical Center. Welcome to the program, Doctor.
Thank you, Doc, for having me.
Now, this season, first day of classes, first time sa school yung anak, it's very stressful, not just for the child, but for the parents as well. Do you agree?
Definitely. The weeks and days leading to the opening of classes can be anxiety-provoking for parents because of all the responsibilities that they need to fulfill to ensure the education of their children.
Now, are there certain stressors that are common for a lot of people that people encounter every day?
Yes, definitely. We should remember that stress is a normal part of life, and it can happen to anyone. And the potential sources of distress can be family-related, like conflicts within the family, death in the family. It can be work-related, conflicts with colleagues at work, workload.
Maybe financial things.
Financial concerns, and maybe environmental causes as well, like traffic, which is very, it's a major problem now, and pollution.
How can someone tell if the stress that they're feeling, the anxiety that they're feeling is already past normal?
There are some red flags that we
Right.
need to take note of, especially if the stress is prolonged. if it becomes persistent and it reaches a point that it disrupts or affects the functionality of the individual already. Like, for example, parents will not be able to take good care of their children, will not be able to function productively at work. Physically, some symptoms would include having different forms of bodily aches and pains. It's very common for parents, or for any adult for that matter, to complain of having headache, backache, leg pains, and even if we give or bombard with any medication to address the pain remains. So those are symptoms. And lastly is the emotional. So sometimes when the stress is prolonged, it can lead to symptoms of anxiety and depression, prolonged sadness, and the patient or the parent can isolate themselves to the point that they might not be able to take care of their children anymore.
Right.
So those are red flags for us to say that there is an effect on the overall functionality already.
So could you give us some practical tips for those parents who feel that anxiety, when classes are starting with their first kids, and how should they deal with it?
Because what we should remember, Doc, in stress is that there is that feeling of loss of control over a specific situation which is perceived as stressful. So some of the techniques is meant to help them regain that that control, that loss of control, to regain back that control and thereby lessen the tension. So some of these would include self-care is very basic. If they can make time to engage in activities or hobbies which would make them feel relaxed and calm and happy. Some techniques would include making sure that they reconnect with friends, reconnect with their spouses, in the same way that they are able to discuss and reconnect also with co-parents from the school so that they can exchange notes on how to adjust better during the school year.
So what you suggest is, aside from having a family, doing all your responsibilities, you still need that me time. You still need that couple time.
Definitely. Me time, self-care. So if massage helps you relieve that tension inside, or going to watch movie with your spouse, then definitely make time for that.
Okay, very well said. Do you have a message for our audience, Dr.
Stress, again, it's a normal part of life. We cannot avoid it, as well as anger. It's an emotion which is normal. But what is important is that we are able to manage stress and cope in a healthy manner.
Okay, thank you very much, Dr. Joan May Perez Rifarial, for sharing your expertise. And I guess one of it also, if someone who hears this really feels that they cannot cope with it, it's okay to talk to a professional, a psychiatrist, regarding what they feel inside.
Definitely, with the red flags mentioned earlier, if it's prolonged already, if it's affecting their functionality at work, if it affects the relationships due to persistent conflicts, and there are more serious signs or symptoms of anxiety, depression, definitely I suggest seek help and talk to someone, a professional.
Very well said. Thank you very much, Dr.
Thank you.
And one of the health threats in the communities, including schools, is getting infected with dengue. Dr. Franklin Diza from the Department of Health tells us more about this disease when MedTalk Health Talk returns. According to the World Health Organization, or WHO, the Philippines is among the countries in the Western Pacific region with an increased number of dengue cases in the first months of 2019. And as of April 2019, almost 60,000 dengue cases were reported, compared to just a little over 32,000 cases on the same period last year. What can we do to finally eliminate the risks of dengue, especially now that some classes have already started? To discuss more about this, we have on the program Dr. Franklin Diza, Chief of the Infectious Disease Prevention and Control Division of the Department of Health. Welcome to the show, Doctor.
Thank you, Dr. Freddy, for having me here.
Now, Doc, it's that time of season again. Ayan, pasukan na naman, especially now na one of the risks is dengue. Although dengue now is a risk actually year-round, ano, Doc? Pero for those who still aren't aware, what exactly is dengue?
Dengue is a viral disease being transmitted by a mosquito. We call them the Aedes aegypti or Aedes albopictus.
So, dapat importante na yung specific mosquito na yun, ano, ang actually kumagat sa tao. Because yun ang pinaka-carrier ng dengue virus.
Tama po.
Ngayon, let's talk about ano bang mga simptomas ang pangkaraniwan sa isang tao na apektuhan ng dengue.
Yung mga symptoms na specific usually, parang influenza-like symptoms na tinatawag natin. Plus to headaches or stomachache or body malaise o di kaya muscle pains, joint pains, retroorbital, ibig sabihin dito sa likod ng mata natin, may mga sakit din. Ganon usually ang mga manifestation ng dengue. Pero dapat malaman din natin na merong tayong classification na tinatawag natin. Merong yung dengue without warning signs. Meron tayong papunta na dun sa dengue with warning signs and then severe dengue.
Okay. So doon sa sinabi niyo, Doctor, is ang simptomas ng dengue parang pangkaraniwan lang. Para ka ng kalagnat o sipon na similar mga simptomas dito. Meron bang time frame na importante dito sa sakit na dengue?
Unang-una, ang importante is yung first 3 days. Dapat ma-examine na kung meron siyang dengue o wala. Dahil nga non-specific ang mga simptomas na sinasabi natin kanina. Akala natin pangkaraniwang lagnat lang o pangkaraniwang influenza lang o trangkaso na tinatawag natin. Pero kailangan matesting ka agad sa first 3 days para malaman kung may dengue o wala.
Base doon, Doctor, what is the best way for communities or even the individual tao, paano sila makakatulong para lunasan ang paglaganap ng dengue?
Dito sa dengue, involvement. Kasi nga, halimbawa, vector control. Ang isang one dyan is search and destroy. Doon yung 4S natin nanggagaling sa vector control, search and destroy. Dapat ma-involve lahat ng tao para tumulong sa pagtuklas kung saan nanggagaling yung mga lamok na yan, saan nag-breed yung mga lamok na yan. Yun ang isang dapat gawin sa community.
Ito bang klaseng klima na tag-init, mas magandang environment para sa mga Aedes aegypti o sa mga lamok that carry dengue to flourish?
Mas mabilis silang mag-propagate o di kaya mas mabilis silang mag-mature. Pag mabilis silang mag-mature, lalong-lalo na yung mga larvae. Yung larvae mabilis mag-hatch. At kung mabilis silang mag-hatch, maliliit din yung mga lamok na mapipisa. Pero high ang metabolism nila, mataas. Kaya mas aktibo sila na mangagat dahil para masustain nila yung metabolism nila. Ngayon, mas mabilis din silang mangitlog pag ganun. Mas dumadami ang lamok, mas dumadami ang magkakalat ng dengue.
Okay.
Ganun ang epekto ng mainit na klima.
Okay. Now, a lot of people have some notions about dengue, ano? And one of these is nasa kaalaman ng marami na kapag nakagat na sila ng lamok, automatic may dengue na sila.
Hindi naman. Kaya lang, sa ngayon, dahil high prevalence ang Philippines, pag meron kang mga simptomas, isipin na natin unang-una dengue muna.
Okay.
Para malunasan o di kaya mabigyan karapatang lunas para hindi pupunta doon sa critical o di kaya yung severe dengue.
So ang thinking natin yun is it is dengue until proven, otherwise.
Yeah. Kaya doon dapat tayo mag-focus. Ano yung mga delays? Dapat ito, yung matuklasan mo kaagad, mabigyan mo ng lunas, o di kaya i-refer mo kaagad sa kinaukulang mga establishmento na magbibigay sa kanila ng lunas.
Okay. And for your final word, Doctor, do you have a message for our viewers out there regarding dengue?
Ang sa akin lang naman sa dengue, yung word na involvement natin kanina. Dahil ang importante yung vector control at sa control ng pagkalat ng dengue disease, no? Kaya ma-involve dapat lahat ng tao. Hindi lang yung komunidad, kundi lahat ng ahensya ng gobyerno dapat involved din yan. Dahil sanitation, kasama yan. Iyon lang ang aking may message sa ating mga kababayan.
Well, thank you very much also, Dr. Franklin Diza from the Department of Health, for sharing your knowledge and clearing up several factors that we have regarding dengue.
All the time. Thank you very much, Dave.
Okay, thank you, Doctor. And we will see you again next time as we give you topics that take control of your health. I'm Dr. Freddy Gomez. Thank you for watching.